You know there are 5 common ED myths that you believe is true and is not true? Stay tuned. Today I'm going to talk about 5 common ED myths that is supposedly you thought it was true, but it's really not true. So let's break it down. Myth number 1: ED only affect older men. While it's somewhat true that the older you are, there's more prevalence of men having ED because as you get older, you tend to have high blood pressure, high cholesterol, or diabetes and obesity. And it affects you over time as you get older. It's kind of like an older car. The more you drive it, the more chance it's going to break down, right? Well, it's the same thing, but it doesn't necessarily mean that ED affects you when you get older. It's just that you have more predisposing medical disease that contribute to ED. Now, ED is a symptom. It is not a disease. The disease is high blood pressure, high cholesterol, and diabetes. That's the disease that contribute to ED, or like low testosterone or hypogonadism. So, in a sense, that doesn't necessarily mean that young men cannot have ED. You can still have ED because of lifestyle factors such as smoking, excessive alcohol, or obesity, and also psychological factors such as stress, anxiety, depression, and PTSD. In fact, 50% of men between the age of 40 to 70 have ED, and under 40, it ranges from about between 5 up to 15%. And now we're seeing men in their 20s with ED, and it's mainly due to lifestyle factors such as porn, smoking, vaping, and also recreational drugs. So stay tuned. I'll be talking a few next episode about porn and ED. So that's number 1. Myth number 2: ED is just a normal part of aging. While it's true that the prevalence of ED increases with age, but it's not an inevitable part of aging, of getting older, because as you get older, like I talked about before, you tend to have more disease such as high blood pressure, high cholesterol, diabetes. You gain more weight, you don't exercise as much because you may have arthritis in your knee or your hips, and the weight keep adding on, and that you have more things that takes up your time versus when you were younger. However, if you get older and you just change your diet or your exercise regimen and change your lifestyle, you can definitely not have to have ED as you get older. So it is modifiable. Myth number 3 is that ED is solely a physical issue. While 90% of the cause of ED is physical or due to medical issues, about 10% is due to psychological roots such as anxiety, stress, depression, relationship issues that contribute to the existing physical causes. So when you're treating ED, you're treating both the psychological and the physical issues of ED, and they both interrelate because when you have the psychological component, it may contribute to the physical component, and then the physical can contribute to the psychological as well. Myth number 4: only medication can treat ED. While medication like Viagra, Cialis are commonly prescribed, they are not the only option because we know that ED is a complex process that starts from the brain, that goes to your emotion, goes to your hormone, to your nerve, to your blood vessels, and to the penis muscle. So it goes from here down to your sexual organ. It's not just the sexual organ alone. When you take Viagra, Viagra only relaxes the muscles of the penis by a mechanism called cyclic GMP because it makes that chemical more available, and therefore the smooth muscle of the penis relaxes, and therefore when it relaxes, more blood flow flows into the penis. But Viagra does not help with sexual arousal or libido. You still need to stimulate the brain, the emotions, the hormone, the nerve, and the blood vessels as well. But by just changing your diet to a Mediterranean diet and exercise 30 minutes a day or 3 hours in a week, even just involve walking, stopping smoking, sleeping better, as well as moderating the quantity of alcohol, you can actually help reset the brain, the emotion, the hormone, then the blood vessels as well, and the nerve by just changing your diet and your exercise routine and sleeping better, not being stressed, because all those lifestyle factors that contribute to insult to the brain, the emotion, the nerve, the hormones, and the blood vessel. That's why treating ED has to be a multifaceted approach, like my Get Heart System approach, which addresses the whole six system of the sexual response and not just one. Because when you're taking Viagra, you're just addressing the penis muscle relaxation. That's why it's not effective in all men. It's effective in about 60 to 70% of men using it, and it's almost like a crutch. So ED, it involved from your head all the way down to your sexual organ, and you cannot ignore the organ of the brain and the nerve and the emotions as well as the blood vessel. Myth number 5: ED is not treatable. This is significant misconception that can lead to hopelessness and frustration. I can't tell you how many men I see in groups in quorum that essentially said, I'm hopeless. I'm just going to have to live with this. I have to live with an ED life. I feel hopeless. I can't live with this. Well, the truth is that many causes of ED are actually treatable. And oftentimes, something just tweaking your diet and sleeping a little bit better and just doing a little bit of exercise and doing intermittent fasting will go a long way. I've seen patients, all they do is just decrease their carbohydrate content. They sleep a little bit better, add a little bit of intermittent fasting, meaning you stop eating at 8 p.m. and start eating around 11 a.m. the next day. I've seen their testosterone level increase. They're now starting to get morning erection. So just little tweaks like that will go a long way. Sometimes you almost think, oh my God, something as complex as ED and something important as ED can really be changed with just a simple diet change. There's sometimes the basic thing, the things that we take granted, and sometimes that are free, are actually more effective than the complex process and treatment that have to pay a lot of money for. Yes, because I've seen patients changing just those little tweaks and they actually notice an improvement in their morning erection. Like, for instance, I have a patient in my Modern Man Club where I coach men with ED twice a month, and men are supported in a supportive environment with other men with ED will share their stories and share their successes. And I've noticed there's a guy in there named is Carl, and he has prostate cancer. When he was like 44 years old, had the surgery done, and he had ED as one of the complications. He took Viagra and Cialis, none of it worked. His doctor said, live with it or get a penile implant. Well, he found us, the Modern Man Club, and he'd been in coaching and was really an eye opener for him because he realized that he does not have to live with ED, and he's only in his 40s now. So he started intermittent fasting. He started using the morning wood smoothie or recipe. And those of you that are interested in the morning wood smoothie, I can put the link to the morning wood smoothie in my show note as well. And then he just started eating less carbohydrates, started kind of instituting the Mediterranean diet in his daily routine. And he's now waking up with morning wood, and he noticed also lost about 20 pounds. His attitude's a lot better. He has more energy. And as he's instituting a better diet and just adding a little bit of exercise to his daily regimen, he's now able to have sex with his girlfriend, where a few months ago, let's say like 4 or 5 months ago, that was an impossibility. And this is on a person that has prostate cancer, the worst case of ED you can get. And he's able to get reversal with just a simple diet change, intermittent fasting. And a good morning wood smoothie is just a formula with fruits and vegetables, antioxidant that really help increasing blood flow, and just a little bit of exercise. So it really doesn't take a lot of complex things you have to do to get your sex life back again, but it takes time and it takes effort from you. I know sometimes it could be easy just to pop in a pill and just say, okay, I'm gonna get my erection back. But sometimes a pill becomes a crutch, it becomes a band aid, and you're really not addressing the cause or the disease that's causing you to have ED in the first place. Remember, ED is a symptom of something going on. And when a man has ED, it should be a warning sign. It should be the red light in your car, because you really need to take a step back and realize, okay, what's going on that's causing this ED? And the earlier you start, the easier that you can reverse ED. So I hope you find this useful. I will be so much appreciative if you like, subscribe, comment, let me know if you have any questions. And just remember, men, you are the modern man. You can live more, love more, and be happy. I'll see you in the next episode. Hello there. Want an amazing sex life? This free gift is going to give you more sex by helping you get harder and lasting longer. Let's talk about the most sensitive subject, the effect that aging has on your sex life. If you're over 40, there's about 67% chance that you have to deal with one or more of these issues. You sometimes go soft in the middle of sex. You sometimes have trouble lasting long enough to climax. Your erection just doesn't feel as hard as it used to be, and your penis is not as sensitive as it used to be. You cannot reach orgasm or ejaculate. You sometimes have trouble getting an erection. These things lead to frustration and embarrassment when you cannot please your partner. My name is Dr. Ann Truong, and I've been treating men for issues like this for over 25 years. As a board certified medical doctor who specializes in men's health, I helped over 7,000 men reverse the effect of ED. As a way to introduce you to the ED treatment that I offer, I want to give you the most incredible free gift ever. But don't let the fact that it's free gift fool you. This powerful gift will help you get harder and stay and last longer, and may just revolutionize your sex life, making sex more exciting, more thrilling, and an amazing experience again. How is that? So here's what you're going to get in this most incredible free gift. Number one, a good morning wood smoothie recipe. This is my specially formulated antioxidant recipe that will help you get harder and stay, and stimulating more blood flow. It is formulated to increase your nitrous oxide level, which is one of the biggest keys to making you harder and firmer more often, and will also help you last longer. It is filled with lots of greens that create more nitrous oxide in your blood. This smoothie will give you that morning wood effect and will also make you harder on demand when you need it most. And you'll see the effect in about several weeks. Number two, nitrous oxide testing strip. You will also get two of these strips, which you will use along with simple instruction to test your nitrous oxide level in your saliva. Nitrous oxide is a gas in your body and is required for good blood flow to the organ. The strip can determine if your nitrous oxide are deficient, which can help us advise you on the best way to reverse your ED. Even more important, since ED is an early warning sign of problems with circulation and heart health, this can also be a great way to prevent heart related problems such as strokes and heart attack. Number three, and the best part of all, a 30-day free trial access to the Modern Man Club. As part of our mission to make men hard again, we launched the Modern Man Club as a way to provide education and support to a community of men who's on the path to reversing their ED, with pre-recorded and live session being offered every week. I will help men regain sexual health through training, support. I will be there all the way with you. to hold your hand through, so that way you can overcome ED and have your best sex life. Members rave about this session and the sense of community they gain by being a member of the Modern Man Club. And all you have to do is to say maybe to this offer. And once you say maybe, you will be on your way to a more fulfilling and exciting sex life. So all you have to do is fill down the form below, and then I will see you on the inside. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.